If you have or suspect you may have a health problem, or if you require answers to specific healthcare questions or concerns, you should consult your physician or healthcare provider and not depend solely on information presented in this program.
Hello, I'm Dr. Steve Garner. Happy New Year and welcome to Ask the Doctor. This is our 13th season premiere and it's great to be with you today. As you know, this program was created to assist you in understanding medical issues so you can take charge of your own health. It's more important than ever to become an informed patient, and we are here to bring you timely health discussions. For those who are new to the show, there are two ways to get your questions in. First, you can call the live phone line at 718-499-6101. Second, and I've been getting a lot of these during the break, email us your questions at askthedoctor@netny.net, and we'll bring them into tonight's discussion. Now, for this episode, we have a great panel. We have, first of all, Dr. Tara Khan, General Medicine Attending at the New York Methodist Hospital, and also the CEO and founder of the website docmatcher.com. Next to her is Dr. Helen Kilkin-Sogoloff. She's a pulmonary attending medicine at the New York Methodist Hospital. And finally, Dr. Daniel Stevens, laparoscopic and general surgeon at the Metropolitan Hospital. Welcome to everybody. I just had a public service announcement from the city. As of 7 a.m. tomorrow, all streets will be swept in Park Slope and Crown Heights. It's a pretty good response, right? Only a week and a half. Very good job. But that was some snowstorm, no? I know. You guys all out now? Your cars out?
Finally, yeah. It was amazing. I never saw Union closed down like that.
This morning on 9th Street, I got stopped with snowplows. I don't know what they were doing. It's tossing snow in the streets. So it's, we have to do better. Next time we have to do better. But anyway, welcome back. And before I get to end the news, we're going to be taking some New Year's resolutions from the callers. I thought it would be interesting to hear what their resolutions were. So think about that at home. And it's been an interesting off season. I found some interesting restaurants, actually, that I wanted to bring up. One was in a restaurant called the Brooklyn Larder, L-A-R-D-E-R. I actually looked it up. You know what a larder is? It's a building that houses, it's like a cool building where you could put food, you could put perishables. They used it in England. Oh, so I poked my head, I couldn't get into the store, it was locked, but they have cheese and chocolate and fancy meats. So it's right near Pinchicks. It's the paint store on Flatbush Avenue, right next to that. So it's a heads up, you know, the Brooklyn Larder. If anybody knows more about it, let me know. Also, get to now in the news, okay? Because we got so much to do. It's been a lot building up here. 1 in a billion. We're talking about a new test for cancer. And basically, what a doctor can do is take out a little bit of blood, about 1 teaspoon, and then scrape this blood along something like a toothbrush, very, very small. And the cancer cells get caught on the bristles of the toothbrush. And you can pick out 1 cancer cell out of a billion cells that might be in the blood. Once they have that cell, they can look at it and figure out what type of cancer you have, what's the best treatment. And then very importantly, if you are getting treatment, if you're getting better, you should have fewer of these, and they can begin to see changes. So it's something we never had the ability to do, to actually have the small cancer cell outside of the body. So it isolates the cancer cell and helps to develop treatment and your whole approach. It's going to start trials in 4 months at one of the hospitals at Sloan Kettering. Now, this is coming out of Mass General, this study, so it's a big-time study, and Johnson & Johnson is going to make the device. It should be ready in 2 years for general use, but as I said, if you want to get into trials, it's going to be starting in 4 months at Sloan Kettering, so it's something very interesting. Now, another really controversial topic that we had was, should sleepy surgeons operate? And I know Dr. Stevens is here as a surgeon, and you have the best of intentions. You schedule an elective surgery for the next morning, and then you get called because you get called for a gunshot, or you get called because somebody's bleeding. You come in at night. Some people have printed an editorial saying that surgeon is obligated to tell the patient that he didn't sleep at night. I don't know what you think, but I think it's getting a little bit crazy because, well, you're going to tell them you had a bad night, you got a fault with your wife, or you didn't eat properly, or what if you took sleeping pills, you don't get quite as good as sleep, you feel a little groggy. So, and is the group that did it naturally was anesthesiologists, not surgeons. So I wonder, what about anesthesiologists? What about the internist? What about the cab driver that you get in the cab, and if he didn't sleep, do you need to know that? So I think we're getting a little bit crazy. And they had actually advocated having them sign a consent, the patient, that he's allowing the surgeon to do it even though he knows he's sleepy. Do you have any thoughts on that?
It's going to be very tough to do that. I think you just have to pick a surgeon that you trust his judgment. So that's the most important thing.
Yeah, and we got so many emails from around the country on that one. It's interesting. A couple of days ago, I did this interview on Fox, and we're getting calls now from Oregon, exotic places like that. So Oregon's pretty exotic. Have you ever been there?
No.
Anybody been to Oregon?
It is exotic, yes.
No.
It's
Very
interesting.
interesting place, though.
Now, we have a very exciting event on Sunday, a live Meet the Doctors, Ask the Doctor. So we're going to actually film a show, and we're going to show it on the web. We're going to show it on the network, clips of it, at the Church of the Virgin Mary. Now, that's in Park Slope, Brooklyn. It's on 8th Avenue and 2nd Street. And we're going to have a very exciting group of doctors who actually belong to that church. We have Dr. Emil Bakash and Dr. Ellie Saman. So they'll be at the session, and Dr. Margarita Kutsina will be there as well. And basically, we're going to have a lot of fun. We're going to have special prizes. A mug like this might be, you may win that. And we have a little food beforehand. So it's going to be a great show and a chance to get on TV. If you always wanted to see what you look like, this is the opportunity. It's kind of exciting, no?
That is exciting.
So live Ask the Doctor, and we'll talk about that a little bit later. You know, during the break, you see a lot of people that watch the show. I had to give a shout out to a loyal listener, Antonio Gaeta from Tonio's. He's had a restaurant on 7th Avenue. And I walked by, he says, "You never mentioned my restaurant," and it's a great restaurant. And I suggest you go in there, and you can sample his fine mix of northern and southern Italian cuisine on Sunday. So you go to the show, and you go to the thing. Or maybe check out the Brooklyn Larder and see what they're doing over there. All right, now, Monsignor Bennett has not missed an opening. He's missed one show in the entire collection of 13 seasons. Monsignor, I don't know, it's amazing. And he just moved recently to the Kings Plaza area. So I'm going to be out there to see you soon, Monsignor. It's great to come in. Now, the quiz, because I'm tired already. I feel like we've done the show, and I'm ready to go home. Okay. Name the oldest living New Yorker. Now, Monsignor, put your hand down. It's not you over there. So Monsignor's always going to give him. But name the oldest living New Yorker. Hint. It's over 150 years old. Okay, I'll give you more of a hint as the show goes on. But what we're going to do is we're going to take a short break. Then we're going to come back and we're going to answer your questions. So the topics are general medicine, lung disease, laparoscopic surgery, and emergency medicine. Because Dr. Tarakana also does emergency medicine, a lot of backaches, ankle sprains, maybe some heart attacks, shoveling snow out there. We'll talk a little bit about that. So the number to call is 718-499-6101, or email the questions to askthedoctor@netny.net, and we're going to be right back. I'm Dr. Steve Garner, the host of Ask the Doctor. In addition to watching Ask the Doctor every Tuesday night at 8, you can also visit www.netny.net/askthedoctor. There you can find the topics and guests of each episode. You can read my column from the week for the tablet, and for more advice, you can watch episodes you've missed. More importantly, you can post your questions and I'll answer them on the video blog. So visit www.netny.net/askthedoctor and get your daily dose of healthy advice. And welcome back to Ask the Doctor, where we were just talking about the movie The King's Speech. So that was a good movie. I think it made
It was fantastic. We just saw it the other day.
Academy Award winner, right?
Oh, absolutely.
Where'd you see it?
In Staten Island with my family.
Okay.
It
So
was
did
great.
BAM. Beautiful.
Yeah.
Yeah.
Excellent.
So anyway, we recommend that movie. Now we're going to get back. We don't know. Could it be Joel? Could it be Maddie? Could it be Grace? So let's see who it is. Hello? Hello, who's this, please?
Hello?
Yeah, hi, who's this?
Dr. Don, it's me, Maddie.
Maddie, I don't know how you do it every time, Maddie. You're the first one in.
Yeah, I wanted to know.
What do you-
Yes, I've been waiting a long time. I want to know how come your fingers get stiff and numb?
Okay, Maddie's fingers get stiff and numb. In the morning, Maddie, or all the time?
All the time.
All the time, her fingers are stiff and numb. Who wants to take that one?
Maybe,
Dr. Khan's going to take that.
maybe is it a little bit of arthritis? Do they hurt you?
Maddie, do you have arthritis?
I don't know. I'll tell you the truth.
Do you have trouble in just your fingers or throughout the entire arm?
Fingers, I can move them, but they numb.
It sounds like it could be a few things, maybe a little bit of arthritis.
Yes.
Sometimes it's bad circulation if you're not able to feel them. You can also have nerve problems, and sometimes that can be caused by carpal tunnel.
Uh-huh.
And so probably a good doctor to see for that is a primary doctor or a rheumatologist.
Yeah.
Maddie?
Is there anything that could be done for that?
Well, some anti-inflammatories, if it was, first you should find out what it is.
Oh, yeah?
And if it is something like carpal tunnel, anti-inflammatories, and there's special exercises.
Okay.
But Maddie, as stiff as they are, how do you still manage to call in first? You see, it's not
That's
that
a good
bad, right?
Okay.
Okay, Maddie. It's
All
good
right.
to talk to you. We'll go to Fran before we go to an email. Hi, Fran. How are you?
Good. How you doing?
Where are you calling us from?
I'm calling from Brooklyn,
Oh,
Highway area,
Which part?
Kings Highway.
Kings Highway. Actually, nice area. The Sunset Cafe. You ever eat there?
Yes, I did.
What do you think?
It's great.
Yeah, me too. So, what can we do for you?
Doc, I've been thinking about plastic surgery. I'm talking about not the facelift. I'm talking about tummy tuck and the liposuction. I just been thinking about it for a couple of years. I didn't know where to go because I'm afraid certain issues I see on TV and I hear on TV. I just don't know where to go.
Okay,
I want to, but I'm afraid to.
let's ask Dr. Stevens about that. What do you think about choosing the right doctor?
Well, it's a great question, Fran. Every surgery, every procedure, every time you do something interventional, there's always a risk. So with everything that you do, there's a risk and there's a benefit. So you really need to find a doctor that you get along with, that you trust, and you should discuss with him or her the risk-benefit ratio. Every surgery, no matter what it is, how small or big, it has risk. So, you just have to talk to him and feel comfortable with your surgeon. And if it's right for you, then it may be the right thing to do.
Now, one of my questions were also which doctors. I don't know any of the doctors that I should go to. I don't know. Would you willing to refer me to?
We can definitely get you some names. If you call afterwards, we'll get your number and we'll talk, and we can definitely give you a name of good plastic surgeons.
Or you can email the question. You could always email the question too, and we'll make sure Dr. Stevens gets it, and you'll get an answer.
Absolutely.
Oh, perfect.
Fran, great. So
Great.
where can you eat on Kings Highway that's good?
Oh, that's one of the best restaurants. I always eat there. It's a homemade food. It's David's Restaurant on Kings Highway between East 3rd and East 4th.
And what's the name of it?
David's Restaurant. It's
David's.
Middle Eastern food.
Okay, we'll give it a try. Thanks a lot.
Thank you.
Take care. Having trouble with the audio, right? I can't, a little going in and out. We're now going to go to the email question. We have one of our first email questions is from Shantae. On November 23rd, 2010, my 26-year-old son, according to the Queens County Coroner Office, had a heart attack and died. I did not dispute the fact that he did have a heart attack. However, prior to his death, he was attacked by several guys on his job. One of the guys involved is said to be a professional boxer, and I feel because of this happened to him, it contributed to his death. My question to you is it possible that a hard blow to the chest area could have caused him to go into cardiac arrest? He died a week later after the fight. The coroner said they saw no trauma around the heart or to the head, but I still believe the fight caused my son's death. If it is so that the fight caused his death, is there another way to tell? Maybe they missed it? I would appreciate your input in this matter, Shantae. Dr. Sokolov.
The first question, whether or not the pathology was done, I mean, of course, the answer can be yes, it's possible, but you need to understand what was the pathology on that case. That would be my approach, because you cannot just be disputing the case based on hearsay or what the assumption is. You need to have facts.
Yeah, I think one question that she asked, can you get a heart attack or have a problem from a blow to the chest? No, either my...
You can do this, but at the same time, it has to be proven on the path, whether or not it was indeed the heart attack that caused the death, or whether it was trauma to the heart, whether it was trauma to the pericardium, whether there has to be some proof that it was a heart attack.
Could have also been stress, not necessarily from trauma itself, but he could have been under a lot of stress, which could have led to a heart attack. Possible blow to the chest could cause damage to the heart, leading to a heart attack, but they don't directly see that on the medical examiner report. So it's a difficult, it's a difficult question. It's a difficult thing to prove.
And then can you exhume the body and do an autopsy? And for what? I mean, what are you going to see at that point? The same heart attack?
Right. And remember, the end of death is usually either brain death or heart death. And so there can be other causes that lead to that, but the end result is always a heart attack.
But what's interesting that Dr. Stevens said they did a study recently that showed that 80% of people who had sudden cardiac death had been involved in an altercation, a tense episode, had some episode that raised their stress level. So it's a tip to everyone out here. It's not worth it. Just try and calm down, do some deep breathing, and collect yourself before you start. You're out on the road and you're frustrated. Just take it easy, right? Tough one. We're sorry for the loss there. Should we go to another email? No, let's go to Monica. Monica's on line 3. Hi, Monica.
Yeah.
Hi, Monica. Where are you calling us from?
Manhattan.
Where?
Manhattan.
Manhattan. Very nice. Which neighborhood in the Manhattan?
Upper West Side.
From which part?
Upper West Side.
Upper West Side.
Thank you. I got my translator here, Monica. So what can we do for you?
Oh, I just diagnosed with atrial fibrillation, and I would like to ask the doctor in terms of medication and stuff.
Okay, and how old are you?
53.
Was that the first time you had it?
Yep.
And were you drinking a lot or that night, or eating a lot of coffee, drinking a lot of coffee, or staying up all night, anything like that?
No. Oh, you mean, is that the first time that no, I've been having, a regular heartbeat on and off, but I never, this is the first time I've been diagnosed with atrial fibrillation.
Okay, so who in the panel wants to start? Atrial fibrillation.
Atrial fibrillation can get you suddenly. That's the thing about it. Sometimes as you get a little bit older, it can come on. You never had any problems with your heart before, and now all of a sudden you have this irregular heartbeat. The good news is that it's treatable. In some cases, you can just slow the heart rate down and keep it remain in atrial fibrillation, but protect yourself with blood thinners. And in some cases, they are actually able to stop the heart from being in atrial fibrillation and put it back into to a normal sinus rhythm. So it shouldn't be too big of a problem.
Any other comments on atrial fibrillation?
And what's also important is to figure out what caused that. Of course, coffee drinking, alcohol drinking, and thyroid problems, and high blood pressure, which is poorly controlled, they certainly contribute to people having atrial fibrillation. So it's always very important to get to the cause.
Fran, are you taking your medication now?
I have high blood pressure, but I don't want to take, I cannot take aspirin, and I don't want to take any Coumadin. My question is there anything alternatively that I can take to, control this problem before it become a blood clot,
There is a new medication coming out which is not going to require the same monitoring as Coumadin, and it's supposed to maybe have been approved already, actually. Ask your doctor about the new medication out that replaces Coumadin now and does not require the same monitoring. Okay? You don't have to go and get your blood tested. All right?
Okay, thank you.
Thanks, Fran. Take care. We're now going to go to Joe. Hi, Joe.
Hi.
Where are you calling us from?
Astoria, Queens.
Astoria, beautiful area. A lot of great restaurants out there. I was just at Piccolo the other day.
Oh, yeah?
Yeah, isn't that a great place?
Yeah, good pizza.
Pizza, too, yeah. Where do you like to eat?
Stove Restaurant on 30th Avenue is good.
What kind of food?
It's kind of Irish-American.
Oh, it's nice. And nice for a break, right? A lot of Italian restaurants and stuff. Nice to hear an Irish restaurant.
Yeah.
So what can we do for you?
Well, I have COPD emphysema for about 6 years now. And I'm taking Combivent inhaler and Advair discus. And when I'm at rest, just sitting around, I seem to be okay. But if I have to walk or go upstairs, I lose my breath. I get shortness of breath. And I'm wondering if it's the Advair discus that's giving me shortness of breath.
We have a pulmonologist, a lung specialist, Dr. Sokolow.
The answer to the question is no. The Advair, in fact, is a medication that helps COPD. It has two components to it. One of them is the prednisone, which is decreasing the inflammation in the lung, and the other one is the prolonged-acting albuterol, which helps to open up the airways and give you more air. The key component, though, to the use of the Advair is that you really, really need to understand how to use it. Because the fact that it gets into your mouth does not mean that it gets into your lung. And we're not treating the oral cavity, we treat the lung, in fact. So it's very important to learn how to use it. Not everybody are successful at doing that, and usually what I recommend is for a very short period of time to go to a nebulized treatment, because nebulizers usually carry the same amount of medication, but they deliver it directly to your lung. And if nebulizers do help, then you should certainly learn how to use discus better. And also, I'm not quite sure how bad your lungs at this time, but there've been a lot of articles that are coming out on new medications. Actually, it's not new medication, but the medication called Spiriva, which certainly helps to improve the lung capacity on top of the Advair discus. And once again, it's a once-a-day medication. So number one, I would recommend making sure that it does get into your lungs, and number two, to add Spiriva, so maybe it will help to open up the lungs and help with breathing.
Joe, I hope that helps you.
Okay.
I hope you feel better. Take care.
Thank you very much.
Thanks. Let's go now. We have John, who may have the answer to the quiz. Maybe. John?
Yes, how you doing, Doctor?
Where are you calling us from?
I'm calling you from Brooklyn.
Which part?
Kensington. It's right off Ocean Parkway.
Oh, not far from here. Yes, very good. What's a good restaurant in Kensington?
There's not really too many good ones around here. You have to travel up 18th Avenue into the 60s or beyond. I usually go to, I like a Chinese restaurant at Silver Star on 18th and 62nd, I believe it is.
Silver Star, very nice.
Yeah, it's a good Chinese restaurant.
What's the name of that Italian restaurant in the 60s, 70s on, was it Fifth Avenue or 3rd?
Fifth Avenue or 3rd Avenue?
Not Mike's, Gino's.
Gino's?
You don't like that one?
No, I've been there. I didn't know which one you were talking about. Yeah, no, that's good.
I like that one. They're very nice people. Now,
I love Italian food, so it's not too many that I don't like.
Yeah, how's your weight?
What's that?
You're overweight or you're...
Yeah, I'm having problems with my knees.
Oh, we're going to talk about that in a minute, but I think you have a quiz. You may have the answer to the quiz.
Yes, I have the answer to. I hope I do.
What's the old?
My wife, we had visited this place years ago with my kids. It's called the Tulip Tree. It's about 450 years old. It's in Queens Alley Pond Park.
Oh, this is amazing. But I'm not sure that's the right answer. It's amazing. I've got to go to our sound effects. Okay, so let's wait and see. What do you say, sound effects? Oh, John. The first winner of the 13th season.
First one, huh?
How does it feel? How does it feel?
Great. Great. I feel the first time you win something and starting off the new year. That's great.
Now you know what you win?
What?
You get it's a handmade plaque.
It's not the Mega Millions, right?
No, it's not the Mega.
No part of that.
It's better. The handmade plaque made in Japan. Printed out beautifully. You're going to be very happy. You have a nice place for it?
Oh yeah, sure.
Where's
I'll hang it right in my bedroom above the bed.
All right, John. It's a G-rated show, so it's okay. It's okay. But does this tree have any romantic thing for you and your wife?
No. Well, no. Years ago, we were visiting and we went there with the kids picnicking.
But this could become like your tree, right? You can make something
now.
out of it.
Now we're going to visit more often, I think.
Right. And 450 years old. Is that amazing?
We knew right away. We heard that, the age. We knew it couldn't be a person. And we thought of that, me and my wife.
It's where the Grand Central crosses the Long Island Expressway on a place called East Hampton Avenue, I think.
Right. And now my son, believe it or not, my youngest son, now teaches in Queens, in Jamaica, Queens, Mary Lewis Academy.
Wow.
Mary Lewis Academy in Queens.
Beautiful.
He's up Jamaica Estates now. He's starting his third year as a teacher. And we took him there years ago to the parks.
You know what's interesting? They don't want to publicize where this tree is because they're afraid too many people will go there and kill it. So they keep it very quiet where it is. They allowed us to do it on our show because we have a very low audience. No, But as long as, we don't want this on Channel 2 or something, all right? So keep it under your hat, and it'll be coming your way probably within a week.
About a week, okay.
We send it freight, real freight. Yeah. But anyway, so we congratulate you, and let us know how people like it.
Okay, I will. And I have two questions.
Okay.
Okay, the first one was, I'll get to my leg in a minute, but I went recently to my oncologist, and he gave me a blood test, and he took a lot of vials. Usually when I go to my normal oncologist, my older one retired, and I got a new oncologist.
Uh-huh.
Usually when they do it, they take 2 vials. He took about 6. They said because he does a lot more testing. But he came up with something. When I got it back in the mail, and when I talked to him on the phone, they did the blood test different. See, my blood sugar was always around 70 or 80 in that area. But that day I went to a later appointment. I happened to eat like 40 minutes before the blood test. Then I went in, took the blood test, and when I got it back, the blood sugar, the first number was 143. Then they took there was a whole nother section of it all the way down, and they gave me a final number, your overall glucose number, which was like 120 something. So I asked him, I said, I don't understand this. I've never had this before. Do I have diabetes? He said no. He said no, because all the other factors work in to prevent you from getting it. All the
John, I got to move on. But there's some new tests now that people use to evaluate the glucose.
Yeah.
And it's a hemoglobin A1C test.
Yeah.
And that gives you an overall view of your diabetes state. But you're going to have to call back for question number 2 because I've got to move on. But I congratulate you and have a great week.
Should I hold on to for my address?
Yeah, definitely. You got to give us the address.
Okay.
Okay, take care.
Thanks.
Anthony, how you doing?
How are you tonight?
Good. Where you calling us from?
Middle Village, Queens.
What's out there? I never know exactly. What kind of restaurant you have out there?
There's London Lenny's.
Oh, great place.
And I also go to a steakhouse down in Greenpoint called the Amber Steakhouse.
Oh, that's a new one, huh?
Yeah, it's on Nassau and right off of Exford Street.
Great place. You ever go to London Lenny's anyway? It's worth going. Woodhaven Boulevard? Beautiful place. So what can we do?
Well, actually, my question is I had surgery 2 years ago on my shoulder. And since then, I get a lot of spasms, and I also, where I can't even, hold a fork steady when I'm looking to eat it, my hand will shake.
Okay.
So I was just wondering what that possibly
Dr. Stevens?
What kind of surgery did you have, Anthony?
It was like rotator cuff.
Rotator cuff. Are these symptoms different than you had before the surgery?
Yes. Much different, yes.
All right. So, it's always good to go back to the surgeon who did your operation, number one, if you could find that surgeon, just to talk to him or her and see if this is any relationship to the surgery.
Okay.
It could be something completely different. It could be a nerve. It could be, something in your elbow, something in your hand, and it may not be related to the surgery. The surgeon's going to be the one who will know that. So it's always a good place to start.
Okay, great. I appreciate it.
Anthony, take care. Thanks a lot. What we're going to do now is going to take a short break. We had a lot going on. We're going to come back and talk about general medicine, lung disease, laparoscopic surgery. We're going to want to know about your New Year's resolution, too. Now, the number to call is 718-499-6101. And the email is askthedoctor@netny.net. We'll be right back. I'm Dr. Steve Garner, the host of Ask the Doctor. In addition to watching Ask the Doctor every Tuesday night at 8, you can also visit www.netny.net/askthedoctor. There you can find the topics and guests of each episode. You can read my column from the week for the tablet, and for more advice, you can watch episodes you've missed. More importantly, you can post your questions and I'll answer them on the video blog. So visit www.netny.net/askthedoctor and get your daily dose of healthy advice. And welcome back to Ask the Doctor, where our topics are in general medicine, lung disease, laparoscopic surgery, and emergency medicine. With me I have Dr. Tara Khan, general medicine attending at New York Methodist Hospital, Dr. Helen Kilkin-Sogolov, pulmonary medicine attending at New York Methodist Hospital, and Dr. Daniel Stevens, a laparoscopic and general surgeon at Metropolitan Hospital. Now let's get right to the questions. Hi, how are you? Where are you calling us from?
Richmond.
Richmond Hill.
Yes.
And what can we do for you tonight?
What I'm calling about, my husband has a terrible lung problem, breathing.
Okay.
And it's over a year. And he stopped coughing, and his voice was getting low. He could hardly hear when he talked. And eventually he went to Columbia Presbyterian Hospital, and they diagnosed him with ALS.
Okay.
And I'm just calling because he really do have a terrible lungs problem, and I don't know if there's any treatment or anything for that, for ALS, or if they could find a cure for ALS, and especially for his lungs. The lungs is very bad with breathing. Without the PAP machine, he could not breathe.
Okay, it's a tough one. Dr. Sogolov, do you see a lot of that?
That's a tough one because I really sympathize, and I'm sorry for what you have. But what I usually recommend is when you have a rare entity, I don't care if that's your lungs or your heart, you are in the right place. And there are multiple studies that are coming out of National Institute of Health, and the way usually the National Institute of Health is handling it is that they approach the big centers like Columbia Presbyterian, Cornell, Mount Sinai, because those are the centers who are usually best at handling very complicated pulmonary problems like this one, and they're usually the one which, if there's anything in the air, like for example this new medication or the new test for cancer, that's the centers that they approach, and those are the protocols that they usually run.
Dr. Khan, if they want to find a doctor, let's say at Columbia, can they use your match doctor?
Absolutely.
How do they do that?
You just go to www.docmatcher.com and you can find the perfect doctor for you. You can put in certain disease types. I don't think that we have anybody treating ALS at this moment, but there very well might be. And you can search by specialty, you can search by type of doctor, or anything really, personality. And you can find the perfect doctor to help treat your family member or yourself.
We're sorry, and we hope you're at the right place.
husband
That's the main thing. You're doing the right thing. We're now going to go to Larry on line 4. I don't know if this is Larry from Rockland County.
This is Larry from Rockland County, Dr. Garner. How are you?
Calls for the furthest distance and on the computer watches this. But we're having trouble getting the New Year's resolutions out of people tonight. What is your New Year's resolution?
Not to make New Year's resolutions.
Okay, that's just the way we rehearsed it. No, so what do we have tonight?
I have a question for Dr. Stephens. I had read an article. How are you, Doctor?
How are you, Larry?
I read an article in one of my magazines that said that people who have bariatric surgery, after a couple of years, they've regained their weight again. Is this an organic problem or is this a nutritional problem? Because I happen to know a couple of people who've had it, and they did lose weight initially, and now they're almost back where they started from.
Fantastic question. You always pick the best questions. This is really a great question because it's a very difficult answer. It's true. Up to 40% of patients can regain their weight after about 2 years after bariatric surgery. No one's really sure exactly how it happens. It could be that the pouch in the gastric bypass dilates. It could be that the rest of your body accommodates to having part of your intestine bypassed, and some of the bowel hypertrophies and absorbs more calories. It could be hormonal, and then there's other ways that we probably don't understand why we regain the weight. And there are newer operations. There's the sleeve gastrectomy, the lap band. All of these operations have different profiles of safety and efficacy and weight regain afterwards. So, and it's also possible to revise a bariatric operation that was done several years ago. So if you know someone personally that's concerned, it's a real problem. They may need a revisional surgery, and you really need to see a specialist who specializes in revisional bariatric surgery. But it is a real problem.
Okay.
Larry, thanks so much for the question. How'd you make out? You had a lot of snow up there?
Yes, we had our fair share, but I heard that New York City was really impinged upon, as they say.
Yeah, it was rough. But anyway, we're all okay now, and we're ready to start season 13. So
wonderful. Well, good to have you back.
Thanks. Take care. We'll go to Virginia now. Hi, Virginia.
Yes, hi. How are you?
Virginia, what neighborhood are you calling us from?
Bay Ridge.
Bay Ridge. Yeah, you got so many restaurants, right?
Oh, God.
Let me jump to your New Year's resolution.
I didn't make one.
No. All right. Make unrealistic things.
Next year.
Takes the pressure off. What can we do for you?
I have to have my gallbladder out because I don't have gallstones. It's functioning at 4%. And I am on Coumadin. I have arterial fibrillation and high blood pressure. And I understand there are two ways of doing this. One is with Lovenox injections, and the other is with being heparin and going in the hospital early, being monitored, staying overnight. And I was wondering, did Dr. Stephens have any thoughts on both procedures? Of course, my cardiologist will make the final determination.
There are those two ways, and there's also just stopping your Coumadin 5 days before the operation and getting your blood drawn the morning of surgery. That's another way to do it, and you don't necessarily have to be on Lovenox or heparin to bridge the surgery. So there's no right or wrong way to do it. As long as you're anticoagulated appropriately after the operation. Somehow you have to stop the anticoagulation before the operation. If you need the operation, there's no wrong way. So whatever your cardiologist recommends, as long as your surgeon and anesthesiologist are comfortable with that, then I think that's perfectly reasonable.
That's great. I'm glad we were able to help you.
Right. Well, I know my cardiologist would never take me off for 4 or 5 days, but thank you very much.
Okay, take care. Bye. Okay, we have email question number 2. It's hi from Oregon. It's Patricia in Oregon. I listened to your interview on Fox, the breakthrough in fight against cancer. You mentioned clinical trials might be starting. My brother-in-law had a prostatectomy several years ago. Afterwards, the PSA reading continued, so the thinking was that the cancer remained, but it has not located itself anywhere specific. He treats it with a vegan diet and very expensive injections, not certain of what. How would he find out who is doing clinical trial with this new blood test? Patricia in Oregon. And probably the best thing is to call Mass General Hospital Oncology Department, tell them that you heard about the interview, you heard what they're doing. There's going to be 4 main centers throughout the country doing this, and you need, probably a doctor would be the best one to get you into that. So you need a doctor to recommend you anyway. So I would suggest going to your doctor and telling him about it and see what works, okay? Another email I see from Delos, D-E-L-O-S, in Ogden, Utah. I'm telling you, this is spreading out here. I was ecstatic to see a report on Fox regarding a single cancer cell in a blood test. My wife was just this week diagnosed with breast cancer. Will this breakthrough be of any help in her treatment? Will a negative test be able to confirm a cure later? How much does this cost? Delos from Utah. Test is going to cost about $800, and it will be very helpful if this test works the way we think it will in the treatment, because it'll tell, if it's been totally treated, you won't find any cancer cells. If you do find any cancer cells, what type, what do they look like, and we'll be able to devise a treatment specific to your wife's breast cancer. Again, trials are starting in a few weeks, or actually 4 months. The actual use for general public won't be maybe for 2 years, but if you ask your doctor about the trials, maybe you'd like to get into it. Okay? Let's move on to Sandra now. Hi, Sandra. How are you?
Hello.
Hi. Which neighborhood are you calling us from?
I'm calling from Spring Creek in Brooklyn.
Oh, which is that? Spring Creek.
Yes.
Is that on the Bell Parkway?
Yes, it's off Bell Parkway, exit 15.
They built some kind of shopping center there, I see, right?
Oh, yes. It's the Gateway Mall.
Is there
a
restaurant?
I'm right behind.
Is there a restaurant in there?
Yeah, it's the Olive Garden in
yeah. How is that place?
Other.
Olive Garden. Is that any good?
Yeah, it's good. It's always a line.
There's a line to get in there. Wow. So
yes, always.
Never heard of Tara? No good?
Yeah.
It is good.
Very good. Very good. So what's your New Year's resolution?
My New Year's resolution is to take care of myself in a better way.
Excellent. For health-wise?
Yes. No, I work.
At work?
Yes, I work. Yes.
Very nice. Very nice. What can we do for you?
Well, I'm calling because about a year ago, less than that, I went for a test for my kidneys, and they did that. They put me into the machine. They do the testing and the MRI.
Right.
And they find out that I have a black spot on my lung.
Oh.
So my doctor sent me to the lung doctor, and he said a lot of people have that, not to worry. But then I went back in November because I feel a pain. And then he said it was swollen. So I don't understand how something that is not important got to a swollen way. And now, like 5 days ago, I have a pain on my back. Like like inside my that part, it was painful.
So it sounded like you went for a test of the kidneys, and incidentally they noted on one of the tests that there was a spot in the lung.
Yes.
And they said, don't worry about it.
Yes.
But it's bothering you, that it hurts.
Well, then I went back in November, and he told me that my lung was swollen.
Okay, let's see what Dr. Sokolov has to say.
If you don't mind me asking, how big was the spot initially?
He said tiny.
He didn't. There was no number attached to it. Was it less than a centimeter, more than? Was there anything?
He said small, very small.
Okay, and did they mention, is it right side, left side, and how close is this to the spine, or there were no specifics? They just basically say it's a tiny little spot that you have in the lung.
It's a tiny little spot. They didn't measure.
Are you a smoker? Or were you a smoker in the past?
No, I never smoked in my life, and I don't let anybody smoke in my house.
I see. So usually the chances of that being something bad, and of course I understand that you're worried about malignancy, are not very high because you're not a smoker and nobody who is in your household does smoke. But what is the correct approach is the following. Anything that is less than 1 centimeter should be watched very carefully. And by watching very carefully means that every 4 months to 6 months, you should screen it with the CAT scan, which is, I know people are concerned about radiation, but when you look at the risk of radiation versus the risk of not diagnosing a cancer, lung cancer early, I would go with the risk of the CAT scan. So every 4 months for the first year and every 6 months for the second year. If there is no change in size, it's a scar. And usually you should not worry about it, but you should collect the information and keep it with you because that scar will be there forever. So make sure that somebody follows that with CAT scan every 4 months the first year, every 6 months the second year.
Very good. So it sounds like you don't have much to worry about there, okay?
Oh, what about the swelling?
The swelling of the lung, and that some kind of inflammation of the lung.
Inflammation of the lung, there is no such thing as swelling of the lung. Lung has no space to swell, I'll be very honest with you, because it says encased in the ribs. So I would really understand what that swelling means. If that means that there is a swelling of the nodule, then it has to be followed by very carefully and possibly biopsied. If it is a swelling, which means that there is a increase in the lung, I'll be very honest with you, this definition, I'm not
I'm
clear
wondering
as
if
to
it's
what
not
that
fluid,
means.
that maybe she had heart failure. Did you have heart failure?
No, the doctor didn't say any name on it.
Okay, why don't you ask, you should go back and ask him, but as Dr. Sokolov said, it's very little, there's a very, very small chance it's something you're going to worry about. Most likely it's nothing to worry about, but you got to follow it every few months with your doctor. Okay?
All right, I thank you so much. You are the best program.
Oh, thank you very
so
much.
Bye-bye.
Thanks a lot. That was nice. Dr. Tara, I got to ask, this snow, I know you work in the emergency department. What kind of crazy cases did you see during the snow? What would you see typically in the snow?
A lot of course, back injuries, and I think I'm having a heart attack because a lot of reports on the news are telling people, but people forget that they're shoveling and that you actually use those muscles.
Who shouldn't shovel?
Well, I think if you have heart problems such as coronary artery disease, heart failure, you probably shouldn't be shoveling. It's just too much stress, and you don't realize how heavy the snow is, especially when it's wet.
Very nice. Okay. So now we're going to go to Peter, who's been waiting patiently. Hi, Peter.
How are you?
What neighborhood are you calling us from, Peter?
Glen Oaks in Queens.
Where is that?
That's near Floral Park.
Near the ballpark?
No, near Floral Park.
Oh, Floral Park.
Yeah.
What's a restaurant that I might know, the most famous restaurant of Glen Oaks?
Well, you have Jonathan's on Jericho Turnpike. You have Stella's, an Italian restaurant.
Oh, Stella sounds nice. Where's that?
That's right on Jericho Turnpike.
Very nice. So you recommend it?
Yes, it's very good.
Thanks a lot. What can we do for you?
I want to ask you a question about COPD.
Okay.
I got diagnosed about a year ago, and I never smoked a cigarette in my life. And I see a pulmonary doctor every month. And I had a CAT scan done, and they also found these nodules, 2 in one lung and 1 in another. But the pulmonary doctor didn't say anything about having a biopsy done or anything. And I'm just wondering if I should get another opinion, or I had a CAT scan done recently, and the radiologist says to come back in a year. And I'm just wondering, for someone that never smoked, how do you get something like that?
Very similar to our previous caller.
You're talking about how do you get COPD or how do you get the spots in the lung?
No, the COPD with the nodules. I never smoked in my life.
Well, there is, it's not only smoke that causes that. A lot of environmental exposure. A lot of people who work in different kind of factories can unfortunately get COPD. People who had asthma as a child, unfortunately, develop COPD as adults. So it's not necessarily smoke that causes that. So it's.
And those nodules, do they have to come out, or?
Once again, most of the time in non-smokers, nodules are benign. It's almost like when people ask me this question, I said, when you look into the mirror in the morning, you have wrinkles. That's how the lung sort of ages, because it's a wrinkle in the lung. But the best analogy
so
can come up with.
basically, You need some plastic surgery on your lungs. So
Yeah, so most of the time it's nothing to worry about, but certainly has to be watched very carefully.
Thanks for the call.
Okay, thanks.
I went to this Dr. Stevens. I get a lot of times people with gallbladder disease, they have pain in the right. Do they all need surgery? Who needs surgery? Who doesn't? Who can do without it?
Well, if you have symptoms, if you have bad pain when you eat fried and fatty foods, and you have gallstones, then you probably need your gallbladder out. If you've had an infection of your gallbladder, or if you've had pancreatitis caused by gallstones, you need your gallbladder out. If they just find gallstones incidentally on an ultrasound or a CAT scan for something else, and you're having no symptoms, you don't need your gallbladder out.
So I know I had gotten asked by one of the camera guys. So, okay, let's go to Hyacinth now. Hi, Hyacinth.
Hello.
Which neighborhood are you calling us from?
I'm calling from Crown Heights.
Crown Heights, great area. How are things out there tonight?
It's pretty okay.
The snow is gone or no? I know that was one of the last areas to get cleaned.
Yes.
Terrible.
But it's cleaned up pretty well.
I'm glad. And is there any restaurant that opened up recently? Because we never can find one out there.
Yes, but I'm not a person that eats too much outside.
Oh, so what would you have anything you'd suggest?
Like what?
Like a name of one that we might like to go to?
I just love Red Lobster.
Red Lobster, okay. It's simple. That's good. What can we do for you?
Okay, I was diagnosed with sleep apnea, and I did the study, and the second study I did with a mask, but presently I'm suffering like weakness right through my body. I don't know if it have anything to do with sleep apnea. That's why I'm suffering with the general weakness right now.
Okay, we're going to give a quick answer because we're running a little short, Dr. Sogo.
The answer is always yes, it's a possibility, but not very frequently. Sleep apnea is, you can be tired all the time, absolutely, but weakness, no. Sleep apnea is a very different entity.
Thank you, and we hope to hear from you again, okay?
Okay, well, thank you so much, and have a happy
Take
new year.
Thank you, you too. Talk to Gay now on line 1. Hi, Gay.
Hi.
Where are you calling us from?
Jamaica, Queens.
Oh, Jamaica, Queens. You ever go to you ever hear of Silvercrest, the nursing rehab place out there?
What's the name of it?
Silvercrest? No?
Oh, no.
Very nice place. They're doing a good job on rehab on some relatives. So I've been out there a lot. Where can I eat when I take a break?
Excuse me?
Where can I eat in Jamaica?
Oh, well, not right here. The Blue Bay Diner is good in Fresh Meadows.
What about the Flagship Diner?
Oh, yeah, that's good. That's good.
It's
That's
on Queens
handy.
Boulevard, near Hillside, right?
Yes.
Not bad. I ate there Sunday for $9.95. You get a screwdriver, you get pancakes and tea. Not bad.
Yeah.
What a combo.
Okay.
Very good.
Very good. What can we do for you?
I'm trying to find out. My son has a heart congenital disease, tricuspid atresia.
Okay.
And I'm trying to find out. He had the corrective surgery, but he developed, in the past 5 years, he developed varicose veins, and they bleed, and he has ulcers. And I was just wondering, he goes for wound care, but he hasn't had any luck with that. They have ulcers and they bleed. I was wondering how they treat that.
Dr. Stevens, that's a tough one.
How old is your son?
Well, now he's 27.
All right, so, varicose veins are caused by increased pressure and incompetent veins in the legs. So, the first thing you do is leg elevation. Try not to sit in a chair most of the time. If you're sitting, keep your legs elevated. Walk around as much as possible. And he should probably wear compression stockings if he hasn't had those before. And those are medical-grade compression stockings, not just tight socks. You have to go to the doctor, and they have to give you a prescription for that. And if all of that doesn't work and he's still having bad ulcers and bad symptoms, you can have surgery on varicose veins, varicose vein stripping, where they make small incisions along the course of the leg and they remove the veins. And that's a relatively simple operation, and it helps a lot of people. A vascular surgeon does that.
Hope that helps you, okay?
Okay. Thank
Thanks.
you very
Take care.
much.
Let's go to this email. It's from Mike in Brooklyn and Midwood, actually. He wants to know about flexion contractures. He says he has one, wants to know more before he has a procedure done to see if a specimen removal is cancer or not. What are flexion contractures? Who wants to take that one? Should I take? You want to take that, Dr. Stevens?
Well, I'm not. This is an email question.
Yeah, it's
so
an
we're
email
not sure where it is.
question. No.
There are different kind of flexion contractures. You can have them in the hand, which is called Dupuytren's. You could have them in the leg. You can have them in other areas. I'm not sure what he means about the specimen removal, but he should probably see a rehab doctor, possibly, and possibly a referral to a surgeon, plastic surgeon, depending upon where the contracture is. and ask about procedure to help this.
Thanks you. Let's go to Lena. Hi, Lena. Lena?
This is James.
James, how are you doing?
Okay.
What can we do for you?
What can you do for me? I have illness fundamental AIDS. In the past, I've taken many medications,
Yes.
and I'm left with a unbelievable side effect to the medicine that I've taken in the past. And let me put it this way: it has nothing to do with AZT. Because if I didn't take AZT, I wouldn't be here today. Now, the question is this: in my spine, I am losing the disc between my vertebrae, and I get incredible pain now in my spine. And I've been going to the hospital for special surgery for injections, where they inject a chemical between my vertebrae to give me some sort of a cushion between between my discs. I wanted to know this question: is there any? I've been going now for this procedure, this injection procedure now for many months. Is there anything permanently I can do for my spine so I don't have to go through this anymore?
Yeah, so he's losing the cushion or the disc that's between the vertebral bodies and the spine, and they're putting in artificial to try and give him that cushion. It's a treatment. There are treatments. There's vertebroplasty, which you can give when the vertebral body collapses. And I'm not sure if we're just talking about the disc being gone or the damage to the bone itself.
Well, it's not. I also have now damage to the bone itself, but the disc.
Just the disc.
The disc have dissolved in my body.
Right. I don't know of anything else. Does anybody in the panel know of any new?
No.
Unfortunately, we're not aware of any new treatment for that other than what you're getting. I hope that it helps, and thanks for calling, and give us a call back. Hi, Lena.
Hello, doctor. How are you?
Hi. Which neighborhood are you from?
Queens.
Queens where?
Elmhurst.
Elmhurst, yeah. What can we do for you?
I have a lot of problem in my feet. Actually, I have a flat feet, and now I really have a lot of problem. I cannot bend, and it's like very stiff. It's like I can bend. I can wear certain shoes. And I went to the doctor a long time ago. Like 30 years ago I went, and then like 20 years, and then every time I go and they can't find anything, they said, well, when it's a lot of pain, we can do the surgery. So I don't want to take chances doing the surgery when I don't even know what surgery they're going to do on my feet. So anyway, I have a lot of pain in my...
right, so Lena, let me just paraphrase. So it sounds like flat feet, a lot of pain, difficulty moving the digits.
I'd be interested to know if you've seen a podiatrist before. A foot doctor, a specialist?
Lena?
I went to Elmhurst, so that is like almost over 15 years, I guess 20 years ago. They did all kind of x-rays and everything. They couldn't find anything.
Orthotics, and we got to close, but keep in mind orthotics, okay? And they can help you. They can put something in your shoe and take away this pain. So you go and see, you can call Dr. Tara's service that she's talking about, where you can pick a doctor, but you should see a podiatrist. Okay, Lena?
Definitely.
Call back early next time.
Yeah,
So I can't believe it. We came to the end of our first show. I want to thank you guys for being a part of history. 13th season. And that's it for this episode. So Dr. Khan, Dr. Sogolov, Dr. Stevens, and we hope that you and the audience were able to help you. It's good to remember you should always be proactive about your health. Speak to your doctors. Speak about your concerns. Don't be afraid to go for a second or a third opinion. In the meantime, visit our website at netny.net/askthedoctor. Here you can see video blogs, the tablet column, podcast, forum, send in your quiz suggestions, and many more. Also, join us this Sunday. I'm looking for a big turnout here on Sunday, January 9th at 1 p.m., where you can bring your questions in person to the Church of the Virgin Mary in Park Slope. That's 8th Avenue and 2nd Street. And we're going to have some refreshments and party gifts and so on. So we hope to see you there. We want to thank you for all your questions. Now, next week's episode deals with gynecology, oncology, rheumatology, and geriatric medicine. Goodbye, stay healthy, and I'll see you in the tablet.